Hello everyone. Today is World Sickle Cell Awareness Day. So sickle cell disease is very commonly found across the country, across the world, and it is not very well known of. Many a times you have sickle cell disease and you actually don't know that you're suffering from it. It contributes to the 20 to 23% of the global disease burden when it comes to blood-related disorders. So how do you know if you have sickle cell disease or if you have sickle cell anemia? There are a few symptoms. Certain signs that go on are generally weakness, easily you get tired, you get worked up very easily, you run breathless, there are bone pains, there are aches, there is headache, there is body ache, there are joint pains. These are the very common symptoms that we find in sickle cell disease. It's generally seen, it starts in the childhood, but it usually flares by the time you're an adult. So why does sickle cell disease even happen? So whenever there is an abnormality in the blood or rather in the hemoglobin structure, it causes sickling. वो sickle की तरह दिखता है, C shape. That's the reason it is called sickle cell disease. Because RBC जो है आपकी वो dry out होके sickle के form में आ जाती है. It forms a lot of clots. It obstructs the blood flow. So you will often find a sudden rise in heart attacks, in strokes in patients with sickle cell disease. Usually in adulthood it presents as stroke or as a heart attack. So how do you diagnose a sickle cell disease, or how do you know that you should get yourself checked? If you're having any weakness, if you're having breathlessness, if you're having chest pain, continuous body aches, you should go ahead with diagnosing this disease. And for diagnosis, please visit your physician or a hematologist, and we will guide you with getting a CBC, a peripheral smear, and some specific tests to identify if you have the sickle cell anemia. Why is sickle cell anemia so important? Why are we focusing on it so much? Because once it happens, many a times patients end up in a crisis. So when you have a crisis, you often need to be given blood, you need to be transfused a lot of blood. And blood donation is something that just went out, the World Blood Donation Awareness Day just went a few days ago. So blood is not something, despite of so many awareness drives, that people still come up with. So it's very strongly advised that a healthy individual should go ahead with blood donation because it helps 1,000 lives. Because often we need it for sickle cell disease. Many a times when you do not present in crisis, you need to be started on certain blood-related medicines which will which will make sure that the sickling does not happen and the coagulability or the thickness of the blood is not very severe. So this ensures that your blood, which is circulating right from your brain to your toes to every organ, is perfectly fine and healthy. So I hope this very small snippet and small awareness about sickle cell disease will get you to be more vigilant about it and not ignore when you have joint pains, bone pains, or easy fatigability.